Here's please look right now. Kind of too close. Okay, let's go over your new payday terms really quickly too. Before we get started on this. Okay, so get your payday terms real quick. Kinesiology, we know that logi at the end of a word means what?
Study.
Study of, okay? So kinesio is usually like movement, so study of movement. Like a lot of people who go into coaching, for example, or exercise, athletic training or whatever, will get a degree in kinesiology. A myelogram, okay, we know that gram is a picture or record, and myelo can be spinal cord or what's the other thing it could be? Bone marrow. In this case, it's spinal cord. Okay, so this is like an x-ray or a CAT scan of the spine and the spinal cord to assess it. Cervical, we know what this means, pertaining to the neck. Chondromalacia. Okay, remember that malacia is softening. It's been a while since we learned that word. And chondro is cartilage. Okay, so that means cartilage is not, it's losing kind of its form or its toughness. Craniotomy. We know that tomy at the end of a word means incision or like to cut into. So cranio is your skull. That means to like cut into the skull, or not really an incision. That's kind of a weird thing, but a craniotomy. Could be even just like drilling a hole into the skull or something like that too. Okay, epiphysis, which we'll talk about today. But these are the ends of the long bone. So like the humerus, for example. It's like falling apart on me, so I'm trying to be careful. Or the stand is, he's not. So if you've got like your humerus, for example, your epiphyses are this end and this end. This is the diaphysis in the middle of the long bone. Epiphysis, epiphysis. Remember, epi means like above, like your skin is kind of the outermost layer. Okay, osteitis. Oh, I skipped that one, didn't I? Itis, remember, is inflammation, and osteo is bone. Atrophy means wasting, and this specifically usually talking about muscle. So if somebody's muscle is wasting, like you think about muscle wasting, atrophy is the word. So trophy, I think we've learned that term before, but it's like a formation, okay? So atrophy, A means what? Without. So they lose, that's like when you lose muscle, like maybe you've been really sick, muscles atrophy, or don't have use of, something and it atrophies. Don't use your muscles, that's what happens. Arthralgia is joint pain. Algia is pain. Arthro is joint, like arthritis. It's inflammation. And then myalgia, algia again is pain. Myo is muscle. Remember my big old muscles, so myo. And then your abbreviation CXR is chest x-ray. I think we had that one once before, but anyway. Respiratory system, maybe? Yeah. X-ray, it's just a picture, a radiograph of bones or tissue. Do you remember why it's called X-ray? It was in a video that we watched at the beginning of the year.
Because it was unknown. Something about it being unknown.
Remember, you didn't know what it was, so we called it X-ray. And what did his wife say? I've seen my own death. Yeah. MRI, magnetic resonance imaging. And MRIs and CAT scans, CAT scan for computed tomography, you can't talk. These are to look more at soft tissues, okay? So, which usually how you'll, versus an X-ray, which looks at more dense tissues like bone. And then ROM means range of motion. What does that mean? I'm talking about my arm. What do I mean by range of motion?
How far you can like move it out?
Yeah. What is, I don't know how else to say it besides range of motion. Okay, so can I move it, the whole full range of which the joint can move? Or, you'll meet people, like people have a frozen shoulder. If y'all ever know anybody who has a frozen shoulder, they can only move it so far, and then they just can't move it anymore. The muscles just 2/10. Okay, so that's range of motion. Good. All right, let's talk about this skeletal system. Now, we don't go into even remotely as much detail as I do with my anatomy class. Not nearly as much. We do have about 24 bones that we're going to learn, different ones, and they're all the ones that are listed in here. And you'll have a quiz over those, and you'll have a picture on it. You'll have a picture with words to fill in over those bones next. I think I put it next Tuesday. Yeah, Tuesday the 28th. Okay. So functions of the skeletal system or the bone. Okay, so one, we know it supports, right? So if we didn't have our skeleton, we would just be like a lump of skin, muscles, and we'd just be on the ground, because that's what actually is structure. That's what holds us up. Okay, it protects our vital organs. What are some bones that are an example of that, protecting
Ribs.
vital organs? Ribs, right? Protects the lungs, heart, all those vital organs that are inside the rib cage. What else?
Your skull.
Your skull, right? Your cranium protects what?
Brain.
Your brain, right?
Your pelvis.
Pelvis, and then definitely protect. So good. Movement and coordination with muscles. Okay, so that's how bones move. So, for example, you have your bicep attached up here. It's also attached down here. And so whenever it contracts, it moves these bones together. And that's why your muscles work. Your muscle is not just attached at one bone and that's it. They're always attached to different bones so it can move them wherever it needs to move them. Make sense? They work together. Produces, y'all love me. I know y'all do. Y'all ever watch Madagascar? Every time I'm home, this guy. Ever watch that movie? And the little, what are they called? What are those little squirrel things called?
I know what you're talking about.
Lemurs.
Yeah.
And he uses the hand to point to everyone. I should start doing that. Anyways, so your bone actually produces blood cells and platelets in a process called hematopoiesis. Hemato means what? Hemo and hemato mean the same thing.
The blood.
So hematopoiesis is the process of producing blood, and that occurs in the bone marrow, in the bones. So that's a skeletal system function. And then, of course, our bones store calcium. And that's one thing we don't realize. It's not just like, oh, our bones are made of calcium, but it actually stores it. So let's say our bloodstream, we have to have a certain amount of calcium all the time. Well, if our bloodstream calcium levels get really low, then they send a message to hormones that cause the bone to be broken down, so that when the bone is broken down, calcium is released into the bloodstream until it goes up. And then we have too much calcium in our bloodstream, then another hormone goes back to it and tells them to start storing it up again. That decreases the amount of calcium in our bloodstream. So just constant, homeostasis. Okay, so we have two main sections of our skeleton. We have the axial skeleton and the appendicular. Because your axial skeleton is like the central part of your skeleton. Your head, your skull, cranium, spine, rib cage. And that's all the axial skeleton. The appendicular skeleton is pretty much everything else. I think of appendicular kind of like the peripheral skeleton, like it's towards the outside. So scapula, clavicle, arms, pelvis is part of the appendicular skeleton, and then the legs. So that's how it's separated into those two main groups. Okay, so a few things we need to identify. One, we'll talk about the long bones and the extremities in a minute, and they're pretty easy to pick out. They're usually longer than they are wide. Okay. We have carpals and tarsals in the appendicular skeleton. They kind of have their own thing. They're short bones. So like all these little bitty bones in your hand, okay, like the back of your hand and your wrist, those are carpals. And I remember those because we need to drive a car with your hands, right? You don't drive it with your feet. So carpals is what you use to drive a car. Okay. Try me. Now, one, you can feel one of your carpals. This one that sticks out, you can kind of see it on this guy. This is called the pisiform, and you can find that right here. That bone that sticks out, kind of like down below your pinky, sticks out like way far. Y'all ever bruise that? No, on the other end. On your pinky end.
Oh.
There you go. Yeah. That's your pisiform.
What's this one?
I think that's pretty right. Right now, I haven't studied this one. I have to memorize them every year, all the carpals, because I have them memorized in order, but I don't usually memorize them until it's time. I'm just kidding. I should have them memorized, but I just re-memorize them every year. So tarsals then are the ones in your feet. Okay, so all of these small bones in your feet, those are tarsals. And I remember that because you walk on the street, you're walking on tar, right? Streets are made of tar, so tarsals. Now, we'll say this. Every year I have people who mix up, and they'll say tarsals and tarpals. I will count it wrong if you write that down. This is your one, okay? Carpals, carpals, tarsals, okay? Carpals, tarsals. Like carpal tunnel syndrome. Okay, shoulder bones. Okay, these are part of the appendicular skeleton too. So these are your shoulder blades, are also called your scapula. Not scapula, not like your scapula. Scapula. Okay, that's your shoulder blades. And then the clavicle is your what? That's your collarbone. Okay, somebody put your collarbone up here. Okay, so that's your clavicle. And it's actually connected. You can kind of tell where it connects right here at the edge of your shoulder. Feel that up there? That's part of your scapula. This is the acromion process. Right there. Okay, so these are all ones I want you to know for sure for your quiz. Carpals, tarsals, clavicle, scapula, and then the pelvic bones. Okay, what makes up the pelvis? You have the ilia, or the ilium is singular. That's kind of the winged part of the pelvis. Then you have the ischium, which is like your butt bone that you sit on. Remember, if you sit on something, then you squish it. So you squish with your ish. Okay, that's your bottom. Okay, so you'll never forget it now. And then the front part, which is not on your quiz, I don't know why. This is the pubis bone on the front, and they're actually all fused. Okay, but we call them three different bones because they weren't always fused, but really all fused. Okay, so that's the pubic bone, and then the two sides of the pelvic bone come together. This is called the pubic symphysis. That's where those, remember, symp means together. So that's what that is. It's a cartilage, little cartilage, fibrous cartilage there. Okay. So again, you don't have to know pubic bone for the quiz, but I did want you to know there's three main bones: ilium, ischium, and then the pubis. Okay, the long bones. So here's the ones that you'll need to know for the test. Okay, your humerus is your upper arm bone. This one's easy to remember. Here's your funny bone is attached to the humerus. Okay, that's your funny bone inside your elbow. It's attached on either side. That's actually part of your humerus up here. Okay. Then you have your radius and your ulna. These are your forearm bones. We know the radius is on which side of your arm? The thumb side, okay? It's just like where you take your radial pulse, okay? It's the thumb side, always. Do not get mixed up and say, oh, it's on the left or it's on the inside or the outside. Because what happens when you twist your forearm is they change spots. So if you remember that one's on the inside or outside, you know, you're going to get mixed up because sometimes they're twisted. Just always go with the hand is what I use, or the elbow. You can use that too. Okay, so your thumb side is your radius. Ulna is your pinky side, and your ulna also is what makes your elbow. That's called the olecranon process. Okay, so that is your elbow is part of the ulna, which is connected to your pinky, and you can feel that it's all the way up. That one's easy to find. Okay. Okay, then we have the metacarpals, okay, and just like the carpals, like driving a car, you've got these 5. Now, I always have people who think these are phalanges, but you got to think about what it looks like with skin on. So this is the hand. You know, you've only got 3 phalange bones up here. So this, from here down, is actually the hand, and you can feel them. Okay, those are the metacarpals. Feel those bones in your hand? Okay. Then these are called your phalanges. Or singular, it's your phalanx. Okay, and you've got 3 of them. You've got distal, middle, and that is distal phalange, middle phalange, and opposite of distal is, starts with P. What'd you say?
Distal.
No, but you're close. You're on the right track. Distal, middle, and proximal. Everybody remember those words from way back when? Okay, those are location words. So you got your distal phalange, your middle phalange, and your proximal phalange. Remember, proximal means close to the point of attachment. Distal means away from the point of attachment. Now your thumb is different. It only has 2, distal and proximal. There's no middle one. It's the same thing for your toes. Okay, then in the legs, okay, you've got your femur, which is the largest bone in your body. That's your thigh bone. You got the tibia, which is your shin. Okay, it's your tibia. And then you have the fibula, which is over here on the side. Really, the only place that's kind of easy to feel the fibula is down at your ankle. It makes your outside ankle bone. This is called your lateral malleolus. That fibula makes your ankle bone. Now, this one, a lot of times you can break, but it doesn't necessarily have to be casted. They just tell you to stay off of it until it heals. Because it doesn't carry a lot of weight. It's more of a structure. It's like a structural stability bone. Of course, tibia, and then, and it's the same idea for here. If you write down tibula or fibia, I'm going to count it wrong. A lot of people get those two first letters transposed too. And then you have your you got your metatarsals, okay, and your same idea as your hand. Metatarsals, and then your phalanges again make up your toes. It's the same idea. Distal, middle, proximal, and then your big toe only has 2.
Are you gonna want us to like label distal, middle, and proximal?
No. I'm just letting you know.
Yeah.
No, you don't have to. Just the ones that are listed on here. The only other bone I didn't list on here, and I don't even see it anywhere else. I should have put it on there, is your patella. I learned 7th grade science class, Mr. Trout. Okay, this is your kneecap. And you know, the easy way to remember it is you sit on your paw's knee, paw tell a story, patella. Okay, that's your kneecap. Paw tell a story, it's your kneecap. Sit on my knee. Okay? All right, so that's that. Now for a little bit of bone anatomy. Cranium is the other one I think you know. I don't know if I listed that. Anyway, okay, the proximal epiphysis. If I'm looking at this humerus right here, okay, so epiphysis, remember the ends of the long bone. So this would be the proximal epiphysis, right? Because it's closer to where the arm attaches. So this epiphysis, this end of this long bone would be the distal epiphysis. Okay, proximal distal. That's why we learned those words in the beginning. And then the diaphysis is the central part. Okay. Now, periosteum, what does peri mean? Do what? Around. Okay, so the periosteum, what would you expect it to be? Do what? Yes, periosteum. Osteo is bone, so periosteum is just that layer. It's like a connective tissue layer that's around the bone. It protects it and covers it. Okay, so that's periosteum. Okay, the medullary cavity is this little central portion that's kind of open there in the middle. Okay, we find bone marrow inside there, yellow bone marrow, usually right in the middle. Spongy bone is what we find on the ends. And you can kind of tell here, it really does, it looks like a sponge. Now, it doesn't feel like a sponge, it's not going to be squishy. Okay, but it is open, it has a spongy look to it. You guys have ever, you guys weren't here for 7th grade, but in that 7th grade science room, there's a real skeleton at the back. That's a real skeleton. On the right. And anyways, you can really see the spongy bone really good in that one. Yellow marrow is just fatty marrow. That's what you find in kind of the center of the bone. And then the red marrow, usually towards the ends of the bones, and that's where we find the red blood cells produced. Okay, the axial skeleton. What you need to identify for the axial skeleton. Okay, of course, the cranium, that's your skull. And that's all you need to know for this class. Anatomy. Whenever you guys take anatomy, you'll learn all the bones in the skull. Then you have the spine, and we've learned these spinal sections before at the beginning of the year, so hopefully they'll just be a review for you. And we have the cervical vertebrae. Remember, cervical is neck. And the cervical vertebrae at the top, there's 7 of them. Then we have the thoracic vertebrae. When you think about your thorax, kind of like your central portion, and that's all these. There's 12 thoracic vertebrae, and these bones in the center. And they're each attached to a what? Or actually, they're attached to 2 ribs. So your ribs are attached at the thoracic vertebrae. The lumbar vertebrae are these really large vertebral bones down here at like the arch of your back, right where your back arches. Like, you know, if you've ever sat in a chair and it says it has good lumbar support, that's what it's talking about. It arches right there so that you've got support there. And then the sacrum is this larger bone kind of at the bottom, and the coccyx is the tailbone. Okay. Ribs, you know, we have 12. They attach in the back at the vertebrae, like we said, and in the front at the, you know what this is called? Do it. It is. It's the sternum. There we go. Okay, so your sternum, breastbone, or the sternum. S-T-E-R-N-U-M. S-T-E-R-N-U-M. There's a little one. So this part, actually where they connect, is cartilage. And that gives it some movement, like a little bit of freedom to move. That's one of the reasons you can do CPR on somebody, because that allows for that rib cage to be compressed. You can compress the heart. Okay, good. All right, joints. What is the medical term for joint? Arthro. Good. So joints are just areas where 2 or more bones join together. Okay, ligaments is a type of tissue that connects bone to other bone. Okay, I always think bone a la bone. I don't know if that even makes sense in Spanish, but whatever. Bone a la bone. It's the same. Ligaments, law for ligaments. So bone and bone. And then tendons connect muscle to bone. I'll tell you, somebody said, somebody else in my anatomy class had another way to remember that. Maybe B and L are closer together on the alphabet, and then M and T. I don't know. I bet Mr. Trapp has a way to remember that. We should ask him. I'm sure he's got somebody's names. That would be my guess. Some old student that he had his name. Probably how he remembers ligaments and bones and tendons. Always had a memory tool for everything. Okay, joints. We have 5 types. I'm sorry, there's 4 listed on here. 4 types of joints. We have diarthroses, which are your joints that move really freely. Dia, remember, means complete. Okay, so complete joint, if you will. That would be like your shoulder, your elbow. Okay, they have lots and lots of movement. Amphiarthroses joints are cartilaginous joints, so they move just a little bit. So like your back, and you've got some bend in your back, right? But they don't move. Your back doesn't bend like your elbow does, or at least I hope it does. Some people do this sometimes, but anyway. And then synarthroses are joints that don't move at all. And I don't actually think that the pubic symphysis is a good example of that. It's more like, think about like the joints between the bones in your skull. They're fibrous joints. So when you're born, all of these bones are separate. You ever notice a newborn and their head looks really like, well, one, a lot of times their heads are really pointed. But then if you even notice their bones, sometimes they look like they overlap. Well, that's because those bones are separated. So if they can get through the birth canal, that's why they're shaped like that. But they fuse over the course of that next couple of years. So that's why they have a soft spot. Everybody heard of the soft spot? Like, everybody flips out, touch their head, Well, that's because there's like a space right on top where those bones haven't met up together yet. So it is. It's literally, there's no bone there between their skin and their brain. There's just fibrous tissue. Okay, so they really do have a soft spot, but that's there for growth. And then synovial joints is really in a different kind of classification than these. But synovial joints are like capsulated joints, like your elbows and your knees, and they have synovial fluid in them. All right, fractures. And I'm going to get out, I'll just put the book on board so you don't have to get out the book. Okay, let's look at these on page 197. All right, so you've got a few different things. One, a complex versus a simple fracture. Okay, whenever you hear the word fracture, it just means a break. It's not like some people, it's like, oh, if it's really bad, you broke your bone, and if it's not bad, you just fractured it. In medical terminology, those are the same thing. You break a bone, you fracture it. It's either a complete fracture or it could be a simple fracture. Should I cover everything? So that's it. Now on here, complex. This is complex, but complete. Simple fracture just means that it doesn't go through the skin. Okay, versus one that is I like this one, like open is what I'm trying to say. Open. It still doesn't sound good. Some word my brain is stuck on. I'm sorry. Books, sometimes the books turn things differently and then I get my.
There's compound fracture.
Thank you. Compound. Is it on there?
Yeah.
Oh, hello. Okay. That's what I was thinking. Okay, yes, open, compound. Thank you. So simple fracture means that it stayed inside the skin. Compound or open fracture means it came out of the skin. Okay, so there's bone exposed. Thank you. I'm sorry. I kept looking at complex and I was like, and comminuted, I was like, that's not right. I don't know what's going on. Okay, anyways, that's that. Now, an incomplete fracture is a green stick fracture. And what that means, it's almost like the bone is kind of just like, it's like it bent and it like maybe cracked a little bit, but it's still intact. And that happens a lot of times in kids. Why do you think that is?
Maybe because they're playing and they land on their arm. Funny.
Well, they get lots of injuries. Why do you think it breaks like this versus breaking like a whole fracture simple? Here's the deal, kids' bones are still growing, So they haven't really fully hardened yet. They have lots and lots of collagen in there. And so they have some bend to them, their bones. They can withstand lots of pressure. That's why. It's like they call it a green stick because it's like if you break a twig. If you break a dry twig, it just snaps. But if you try to break a green twig, you know what I'm saying? It just like, you have to like twist it off and it just separates. That's why it's called that. Okay. So green stick, simple or closed, complete break, no broken skin, complex. This book said that was separation in part of the bone, like they actually separate and come apart. Compound or open is a complete, I had it right here, I don't know where my brain is. Woo. Okay, impacted means it's like bone on bone. So maybe they jarred something and it like kind of crushed into each other, if that makes sense, like your bone even within it, so it cracked and kind of like mashed. Comminuted means that it's splintered. Okay, that means it's like shattered the bone. Spiral means that it is twisted. You see this sometimes in like child abuse, like if somebody's grabbed a kid or grabbed them and thrown them or whatever, But that's one way that you might see that because of that twisting action. Another time you see a lot of spiral fractures is in skiing accidents because somebody's will go this way and their ski goes another direction, and so you might see a spiral fracture then too. Depressed is a skull that's, usually in the skull, like somebody, hit them like a blunt force kind of thing on their head. Collis fracture, this is at the distal end of the radius. This is specific to that area. You see that a lot because of fall, so people fall and they put their hands down and do that. And then a compression fracture specifically occurs in vertebrae. It's they just like kind of compress onto each other. Okay, so that's a compression fracture. Okay, and then last, get back to my thing here. Common diseases or illnesses. So we have osteoporosis. This is like brittle bone disease, where bones become really easy to break because bones have just become so brittle. They've lost their ability to retain calcium. A lot of women, particularly after menopause, because estrogen helps you to hang on to your calcium. Other causes might be hormone deficiency if they don't take in enough calcium, and no exercise, specifically weight-bearing exercise. Swimming doesn't help you prevent osteoporosis, walking, and weight-bearing does. Arthritis, of course, is inflammation of a joint. So rheumatoid arthritis is an inflammatory disease. Specifically, this is like an autoimmune disease. Your body's kind of attacking itself at the joint. This is what causes those really severe arthritic. Y'all ever seen anybody who has really severe arthritic hands and it makes their fingers like go kind of opposite direction? That's usually rheumatoid. Osteoarthritis is like your normal arthritis that everybody gets when they get old. Osteoarthritis, they get old, joints wear down, the cartilage wears down, all that gets damaged. That's what that's from. And then osteomyelitis is an infection in the bone, like within the bone. It's very, very, very painful. And a lot of times they have to take that part of the bone out. This is an example. I'll show you this and then we'll be done. This x-ray right here. See that osteomyelitis, you can tell because it's how it's lit up that bone right here. It's starting to travel down here too. So, okay, that's it.